All right, so I'm going to show you guys how to do your first scrub of the day or your preliminary scrub. And so preliminary scrubs are used to get rid of the transient microbes that we have on our skin that normally reside there. So the first thing you're going to want to do is obviously put your hair cover on. You would have come in, changed into your OR scrubs. You would have your shoe covers on, your hair covered, and all of the like. So then you would proceed to the scrub to do your first day scrub. So the first thing you're going to want to do is grab a mask and put it on. So when you're putting on your mask, you want to make sure and pinch that over your nose, because if you're like me, you wear glasses, or in any OR, you're going to have to wear eye protection. You're going to want to pinch that really tight so that your glasses don't fog up. Also, one thing I want to say, when you are tying your mask at the bottom, if you can see your lips, you are not doing it right. It needs to be tight. The whole purpose of a mask is to keep anything that comes out of your mouth or nose from getting into the patient's open body. All right, so I'm ready to go. So now I'm going to turn on my water. All right, so this is a scrub brush. This is what it looks like. It comes with a nail cleaner. It's called a subungual nail cleaner. The area under your nails is called the subungual area. So it has the subungual cleaner and it has the brush. The brush, you'll see when I open it, has a brushy side and then a foam side. So we're going to talk about that as I go through. All right. So the first thing that you want to do is open your scrub brush. So I don't really want to touch inside that. So I'm going to lay that like this and just lay it here. First thing I'm going to do is get my arms wet. I just like to wet them to get it started. All right. So I'm going to go in first and grab my subungual cleaner. So you want to do this under the water, and you don't have to dig under your nails. You just want to go one swipe, because you don't have long nails as a surgical tech, so you shouldn't be having to like dig. So under the water, this must be done. If you're doing it up here, you're doing it wrong. It has to be done under the water, because anything that you pull out, you want to go down the sink. So I do not throw this in there. This is immediately thrown in the trash can. So now I'm ready to start my scrub. So if you look at my nails, as a surgical tech, we do not have nail paint. We cannot have nails that extend past our fingertips, and we do not have fake nails. You see, I have no jewelry. I have no watch on. You cannot wear jewelry. You cannot wear watches. You cannot wear bracelets as a surgical tech. So make sure that you're doing that right. So the first thing I'm going to do is I'm going to wet my brush and get it soapy. So this soap is going to help kill any transient microbes that I have on my skin. So what I like to do is soap it up, and I will just rub the soap up my arms to let that begin working. All right, so you're going to take the brush side. So what we're going to do first is the nails, okay? I know we just did the subungual, but we're going to do it again with the brush. When you're brushing, you're not giving yourself a manicure. You're not doing your cuticles. Your nails need to be like this. So we're going to do 30. So 30 passes. So you can count it in your head. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, all the way to 30. Okay. So when you get that done, you want to open your hand, and you want your hand to remain open for the rest of the time if you can. So I'm going to re-wet that. So you're going to start with your thumb. So you always go distal to proximal. So the most distal was my nails. I'm actually going to cut that off. You want to start at your thumb, and you want to do all of your fingers until you get here. So each finger has 4 planes. There's 1, 2, 3, and 4. So you want to do each plane 3 times. And when I'm doing my thumb and when I'm doing my pinky, I want to come all the way down the side of my hand. So with the scrub brush part, you're going to go 1, 2, 3, 1, 2, 3, 1, 2, 3, and 1, 2, 3. So I've done my whole thumb. So you want to go in between the webbing, 1, 2, 3, 1, 2, 3, 1, 2, 3. So you're doing all of your fingers, and you see how I keep all of my fingers separated. You don't want anything that you've already scrubbed to touch something that is still dirty. So you go all in between and then down there. So I've done all of my fingers. Now you see how I'm keeping my hand up above my elbow. I don't want to let my hand do this because any water that's on my elbow can then contaminate my hand again. So once I've done my fingers, my palm is next. So I'm also going to do 30, and I'm going to take wide strokes so that I hit all of my palm. So I do the palm for 30. I'm going to turn the water on, get this wet again. So I'm going to flip to the foam part of my brush at this point. I'm going to turn my hand this way, and I'm going to get the top of my hand. Also doing 30. Also taking wide strokes so that I get my whole hand. All right, so once I've done the 30, I'm going to come straight down. So when you're scrubbing your forearm, you want it cut into 3 sections. So this is a section, this is a section, and this is a section. So we have 3 sections, 1, 2, and 3. And your scrub should extend to 2 inches above the elbow. So when I start here, I've already done this. I've done this for 30. I'm going to come straight down. Notice how my hand is still upright. So I'm going to go 1, 2, 3, 1, 2, 3, 1, 2, 3, and then 1, 2, 3. So here I come straight down. 1, 2, 3, 1, 2, 3, 1, 2, 3, and 1, 2, 3. You see how I'm getting all of my arm. So here I'm going to come up above my elbow to 2 inches. 1, 2, 3, 1, 2, 3. So I end with my elbow. I'm going to turn it over because some people have crusty, dusty elbows. We're going to do this 20 to 30 times on the elbow. And that arm is done. So at this point, I would switch, and I'm going to go back and do my fingernails here. Remember, it's not the cuticles, it's straight. 1, 2, 3, 4, 5, 6, 7, 8, 9. So you go all the way to 30. Then I'm going to do my fingers. Remember the 4 planes. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. Each finger, all 4 planes. And in between the webbing. And if it's not your dominant hand, it does feel awkward. So even for me, after doing it for so many years, it still feels awkward. So you still just do your best. It'll be fine. All right, so now that I've done that, I'm going to do my palm for 30. Turn my water on, get this a little wet. Now I'm going to do the back of my hand. Making sure to go wide to reach all of the spots for 30. Then I'm coming straight down, back in, and all around, making sure to get each side of my arm. See how I'm not missing anything. Coming up 2 inches above the elbow, and then brush on the elbow for 20 to 30 times. You see how at all times my hands were up above my elbow and not touching. All right, so at this point, I'm ready to throw this in the trash because my scrub is done. So I'm going to throw that there, making sure that my hands are not down below where they should be. So I'm going to turn my water on. So to rinse, what you're going to do, you're going to make sure you don't touch anything in this sink. I can go here and put my hands together and let the soap come off. When I'm coming through though, I want to open my hands, come through, and then out, okay? I'm gonna do it again because I did not get all the soap. Come through and out. Making sure to not let any of that water drip back down my hand. You see how my hand is at an angle. All right, I'm gonna keep this up here. This way, same thing. Rub my hand under the water, come all the way through and out. I'm gonna do it again. And now I'm pretty sure that I've gotten all of the soap off, so I'm gonna stand like this. You cannot flinch the water off, that's a no. You have to just let it drip. You cannot shake your hands like that. That's a no. All right, so when you're drying off, so for a preliminary scrub, you technically would just grab the paper towels that are there because you're not going into the case and you're not trying to be sterile. You were just getting rid of the transient microbes. But if you were going to go in sterile and you had to pull a towel off of your gown, I want to show you how you would do that. So if this is my gown, my sterile setup, and this is my towel, I would want to make sure that I don't drip on that towel, but I would take it and pull it away. So for this, I don't want my two hands to touch. So I'm going to get my towel, just like that, longwise, at one end. I'm going to dry my hands, and I'm going to make sure that I dry them. And I go from distal to proximal, never going back. And you don't rub, you just pat. And you see how I'm keeping my back arched so that this towel does not rub all over my shirt, because if it does, then I would add whatever contaminants I have on my shirt to my clean hands. Same thing, I'm going to take the other side of it and I'm going to dry my other arm. So you would do this, also making sure to arch the back, making sure that I'm patting, not rubbing, so that I don't break the towel. And then that would get thrown away. So if I was going to go into the sterile case and I was going to gown and glove, I would keep my hands up, but because it was just my first scrub of the day, I can put my hands down like normal, and then I would go into my OR and set it up.